Welcome everyone to our webinar, Competency from Day One, How SimCapture Supports Peer-to-Peer and Self-Directed Learning. I'm your host, Andrew Christopik, Global Content Marketing Manager at Laerdal Medical, and I'm joined here in the studio by two of my colleagues. Both are registered nurses and one is a midwife. Shayla, Anna, tell us a little bit about yourselves.
Hi, I'm Shayla Lu, and I'm the educational service developer in Laerdal. And I since working around SimCapture back in 2019, and I'm a big fan of simulation. And I would like to talk with you today about how SimCapture can enhance the learning outcomes for our educators.
Very nice. My name is Anna. I'm a midwifery education lead for Laerdal Medical, and I'm working very intensively to introduce ICM midwifery competencies on SimCapture in many countries for midwifery education.
Very nice. Thank you. And with us online, we're joined by a special guest, Caitlin Picard from the University of Rochester School of Nursing in Rochester, New York. Caitlin, please introduce yourself.
Hi, Andrew. I'm Caitlin, and thanks for having me on this webinar. So I am an assistant professor of clinical nursing at University of Rochester, and I have the pleasure of teaching in both our accelerated undergraduate program and our master's in nursing education program. I also have a really unique role on our education innovation team and am an instructional design coordinator for that undergraduate program. And what's really cool about that role is that I get to, support faculty in implementing active learning strategies and competency-based education, which is really important to ingrain into nursing education curricula because we need to better prepare our students for practice. So within that role, I like to say I get to play in the innovation sandbox every day and do things like what we're going to talk about today, implement new, strategies and platforms to really just enhance the learner experience so that they're ready for clinical practice.
So I'm holding in my hand an orange. Oranges represent one of the oldest skills trainers there have been in nursing education. In earlier days, instructors would hand out an orange and then they'd hand out a syringe and they would tell students, learners, okay, start practicing. They'd practice by themselves and they'd practice with each other. Now, some of you online are probably saying, okay, Boomer, how does this relate to me? How does this relate to my world? Since the day oranges were used, skills trainers, as skills trainers, class size has increased and protocol has changed dramatically. Worldwide, there's a faculty shortage right now. In the US alone, and that's where we have some good statistics, there's an 8% deficit in educators in nursing schools. Schools globally are pushing class sizes to their absolute limit. So what this means is the need for innovative techniques to teach a larger class size and also still cope with that complex protocol. Now, protocol itself, in the 1950s, when oranges were being used, the standard checklist for giving an injection was approximately 8 steps. Today's checklist, depending on whether you're using an antibiotic, a drug, can be as many as 42 steps. 42 steps. So what happens when you're dealing with a larger class size and you're dealing with a more complex protocol? How do you ensure consistency? How do you ensure quality? And how do you ensure competency-based outcomes? So that leads us to our agenda. Today we're going to answer some very specific questions. We're going to address today how peer-to-peer and self-directed learning fits into today's educational paradigm. We're also going to talk a little bit more about the role of skills trainers, and we're going to show some skills trainers. And we're going to show how SimCapture can tie it all together to create order, create consistency, and achieve competency-based outcomes. Caitlin, competency is going to be a recurring theme as we go through this webinar today. How does peer-to-peer learning and self-directed learning support competency-based education?
Yeah, so I think we're still learning a lot about competency-based education as it relates, to the nursing field, but we know its benefits because, other disciplines like medicine, for example, have used it for a long time. And to me, as I start to wrap my head around competency-based education, or CBE as we refer to it as, one of the key pieces is to have, repeated exposure to whatever competency you're trying to build. And in doing so, you really need to ensure that students have multiple opportunities to practice whichever competency they are, trying to build competence in. And a crucial piece to not only that deliberate practice or reinforcement of that competency is also self and peer evaluation during those practice opportunities. And there's a ton of literature out there that, there's a lot of power in self-reflection, but also peer evaluation in order to improve, said skill or competency.
Thank you, Caitlin. As you look at a learner's journey from novice to mastery, what kind of competencies are peer-to-peer and self-directed learning best suited for?
Yeah, I like to think that, there's really any competency that you could ingrain, peer-to-peer or self-directed learning with, as long as you have clear expectations of what you are expecting of your learners, right? However, the way that we have explored peer-to-peer and self-directed learning in our program is really around psychomotor skills. And now we're starting to delve a little bit even into communication skills.
Very good. Thank you. So I'm going to turn now to Sheila and Anna. Are you seeing the same kind of skills as a focus in the work that you're doing?
I would say yes. Peer-to-peer and self-directed learning, actually, they are widely used in psychomotor skills. But of course, as nurses, we also care a lot about how our patients feel. So most of our customers, they also use peer-to-peer and self-directed learning into a blended learning model. So they practice the skills together with some communication skills. Yeah.
Very good. And how about in the world of midwifery?
In the world of midwifery, we are very fortunate because the International Confederation of Midwives have set some global competencies. And we base all education all over the world on these competencies. They also address not only the skills, but also behavior, communication, and respect for care. So that helps really the midwife student and the faculty to actually develop an education towards solid competencies.
Great, thank you. And I think it's worth explaining why we have nursing education and then midwifery here at the table today, because I think you'd both agree they face the same problems, large class sizes, the need, and then complex skills that need to be practiced repetitively. And I really appreciate, Caitlin, that you pointed that out. So that's why we have both elements represented today, because both share that same common need. Caitlin, you're doing something amazing there at Rochester University. Tell us more about your move to a 2-year virtual-based program. What is your overall vision with that program?
Just for some context, the way that we have designed our 24-month virtual program, if you will, is that students, a majority of their learning will be a mix of, asynchronous learning, synchronous, what we're calling recitations, where they check in with the didactic instructors. But a lot of that time, while they're away, not in the in-person environment, they will need to be, completing things on their own, or, participating in self-directed learning. And while we do have the students come to campus for on-campus intensive a few times throughout the course, again, we plan to leverage our skills trainers in SimCapture so that students can practice the skills that they need to, and use the skills trainers if there are certain skills that require equipment. And then because we have SimCapture, we can build our evaluation checklist or rubrics right into that platform so that they can, complete a self evaluation after recording their skill demonstration, or even connect with a peer, and the peer would then provide them an evaluation.
Very good. Thank you. So we started this whole discussion talking about an orange, and oranges being used as skills trainers. Caitlin, can you tell us a little more about, or tell us a bit about the skills trainers that you believe are crucial in this new and virtual learning environment?
Yeah, so we kind of have a unique adoption of the skills trainers, if you will. So we use the skills trainers in our 12-month accelerated program. And one of the reasons we did that is that we realized that we needed, more practice time for students, both in lab and outside of lab. So we have a little bit of experience with those portable task trainers already, which then helped us guide of like, what do we need students to be doing at home? And as a faculty group, we've been discussing what are these foundational skills that we want students to be competent with. And it could be things like sterile field setup, inserting catheters, right? And those are all things that you can do with a portable task trainer at home.
Thank you, Caitlin. Anna, Laerdal is doing some pretty interesting things in the world of midwifery. So I'm going to let you demonstrate a skills trainer that we've developed. And maybe you can tell our audience a little bit about it.
Absolutely. So this is Mama Birthie, a low-fidelity simulator that has been in the market for a few years now with also a C-section module attached to it. But Mama Birthie is really a simulator that students, learners, and practitioners can actually wear and practice specific identified skills. One of those skills could be to actually assess the baby's position in the pelvis, which is a really important skill for midwives, obstetricians, nurse midwives. And in Mama Birthie, we have Baby Birthie with a skull with sutures. So if you give me the skull, thank you, Andrew, you can actually then visualize the different positions. And through a vaginal exam, again, with consent, with communication with the woman or birthing person, really enhance the respectful care, which we have been talking about is very important as part of the skills practice and training. So what I really like with Mama Birthie is that as a learner we can wear it, and that means that the woman and birthing person voice comes out already at the educational stage. So already when you're training for your profession, you get the patient, the client, the woman, the birthing person, part of that discussion and dialogue.
I like that. So you really are you're reinforcing the learning
Yes.
between two people now. The learner that's wearing Mama Birthie, the learner that is actually performing the skills necessary to support childbirth,
Yes.
but those skills are being reinforced on both ends. The person acting as a standardized patient or actor really needs to know what's going on to be able to mimic that for the other learner. So I think that's brilliant.
And I've seen magic happens actually when you have that peer-to-peer learning and when you do a good feedback and debrief and then you actually practice again. And, not only the woman, but also the midwife or nurse midwife redo the practices and the skills again. It's just amazing to watch when you do it more times.
So just very briefly, what skills, what are some of the top level skills that you'll be learning, or maybe conditions of the baby? So you mentioned a breech.
Breech, shoulder dystocia is really one of the top needed practice skills that within midwifery are looking for. Breech, definitely. Decision making around C-section, where that's why the Mama Birthie CS was developed. But also in general, hand washing, how to perform a respectful vaginal exam. Just the communication, respectful care is really something that has been very much addressed globally.
Very good. Thank you very much. Thank you, Anna. Now we're going to turn to Shayla. You're going to talk to us about another skills trainer that Laerdal has developed.
Yes.
Why don't you talk about that, please?
Okay, so let me pull it on to the table first. So up here actually is our modular skills trainer. And this is designed for our students can be like practice their skills anywhere if they want. But of course, just practicing the skill is not enough for the instructor to understand their performance. So if you try to partner it with SimCapture, with that digital platform, actually it provides the opportunity for the student themselves to understand how they really practice the skills, how they really learn it, and also provide the opportunity for the instructor to check their performance as well. So as you can see from here, the modular skills trainer, actually this is just 2 modules over here. So you can do the injection through the injection pads here, and you can also do some like nasal swab or maybe like some other skills training on the face. But along with this, we also have some other components with it. So you can also do something like catheterization, and you can also do something about IV as well. So it really gives the chance for the learner, they can practice the skills not only within the simulation lab, they can also take this portable skills trainer back home and practice their skill with their peer. Yeah.
A big difference from
Yeah, I would say that is a
this.
big difference. At least they can easily practice their skills again, and also with the fidelity. Yeah.
Thank you, Shayla. And just as a reminder, you can learn more about Mama Berthie, Laerdal's modular skills trainer, and Laerdal's other skills trainers by going to laerdal.com or by talking to your local Laerdal representative. Shayla, this is a good opportunity to introduce SimCapture. Can you explain a little bit about SimCapture, what it is, and how it also fits into the concept of peer-to-peer and self-directed learning?
Sure, of course. I would say from a simulation perspective, SimCapture actually is a simulation capture system. It captures all the elements from the very beginning about pre-briefing, how you plan for your simulation, and to simulation activity itself, and also after simulation, if you tend to use simulation as an assessment tool for the learning, it also captures all the data of your evaluations as well. And if you talk about SimCapture from a peer-to-peer or self-directed learning perspective, actually it really gives us a good chance for not only the instructor, but also for the learner to use the digital checklist evaluation tool to evaluate themselves. And it also gives the chance to the learners, they can evaluate themselves and also partner with their peer to gain their confidence and competence about the skills. And the instructor, they can just use their time when they want to log back to the system again and check the performance, check the learning curve of the students. And it really helped the learner to take the learning opportunity back to themselves and be more motivated about the learning.
So let's dive a little deeper. As an educator, how do I use SimCapture to ensure consistency? How do I ensure learning quality and ensure that everybody is striving for the same competency-based outcome?
Yes, I still remember when Caitlin talked about the CBE, competencies-based education. It's very important for also the instructor and the learners. They are aware of what the standards are out there. So when you're using SimCapture can partner with any standards you are using or our customers they are using. So put all those standards, checklist, evaluation into SimCapture and share that checklist at the same time with the learners. So they can just practice and learning, follow all those standards. So make the whole learning journey transparent to our learners so they can gain all the competency, get more comfortable of what they are doing. So when they face the high-stake examination, they feel comfortable. They got all their confidence they need.
Very good. And Caitlin, we're going to get back to you in just one moment, but first I think we want to show a demo of SimCapture. That was a great video. Caitlin, we just saw an example of an instructor looking at data on some skills training. We saw the learners recording themselves. We saw the learners using a checklist. Please explain how you use checklists and assignments along with SimCapture.
So the skills checklist that we have within our LMS or learning management system, which are also coupled with demonstration videos. So as students are watching a demonstration of how to do the skill, they can follow along with the checklist if they wish, so that they can see which step is being done, throughout the skill demonstration. And then because we have those skill checklists built into SimCapture, when students are ready to practice, they can pull up their skills checklist in SimCapture and they can choose to record themselves so that then they can perform a self-evaluation when they watch back the recording of themselves. SimCapture also has a really nice feature where they can do in real time peer evaluation. So instead of doing a self-recording, you can, connect with a peer who could be in a completely different environment because of the virtual connection, and they can watch you in real time and complete the peer evaluation right in the checklist in SimCapture.
Very good. Thank you. Thank you, Caitlin. Anna, how do checklists fit into midwifery and skills training in midwifery and certainly with Mama Berthy?
Together with ICM, the International Confederation of Midwives, we have developed practice sessions on SimCapture. And that is to motivate and encourage and empower learners to actually practice peer-to-peer with themselves. So it's not really directed to an assessment per se, it's more to stimulate practice and to re-practice until it's time for a test or assessment of some sort. So with the practice sessions on their phones, the students get some very, very directive instructions on how to actually practice a certain skill, may it be shoulder dystocia, for example. And then with a scenario, with steps that's required, and the learners are being exposed to the steps already before. So it's not that they feel that it is an assessment, it's more for them to own their own learning. And that is what we see among the midwifery program.
And you see the same thing, and I would imagine in nursing, Shayla, and that topic of ownership, that feeling of owning your learning, I think is important.
Yeah, of course, the student, they really see the value by practicing with the peer or on their own pace and using those standardized checklists to follow the standard to knowing how to finish the skills or performance skills in the correct way really help them to achieve the learning outcomes easier. Yeah.
And I think that ownership is important, that sense of engagement. So let's turn to another question, Caitlin. What is the biggest challenge that clinical educators face when introducing peer-to-peer learning or self-directed learning into their classroom?
Yeah, I think I'm going to approach this question both from the faculty perspective and the student perspective. So, one of the mottos that we have that's really instilled in us by our associate dean, Dr. Rotundo, is that, our student or our learning experience is only as good as the faculty. So she is really invested in faculty development and, in starting a new initiative like, our skills trainer and SimCapture initiative. That was one of the pillars that we started with. Faculty development is crucial. You need to talk to your faculty about what competency-based education is and how, self-directed learning and peer evaluation plays into competency-based education. I'm a firm believer if the faculty don't understand these, theoretical underpinnings, that they're not going to be able to support students with them. And as we know, our students sometimes need to be reinforced with the why of what they're doing, which brings me next to the student lens, right? We also need to work on our student development of what competency-based education is, and again, how, self-directed learning and peer evaluation fits into this. So really talking to them about the what, but also the why are we doing this for you, right? You need, in order to be competent in things, you need repeated exposure and you need to do some self-reflection. And it doesn't certainly hurt to have your peers evaluate you, because nursing is such an interdisciplinary sport or field, I should really say. So you also need to know how to give feedback and feel comfortable giving feedback when somebody is doing something wrong. And to that point, when you're providing peer feedback and receiving it's not punitive. It's really meant to help you grow. So, don't just check all of the boxes because you want your friend to do well. It's, your friend is going to do well if you give them that constructive feedback.
Any quick comments?
Yeah, I would say some of the customer I met or interact before, they love it. They love the peer-to-peer and self-directed learning, but they also feel challenging about that because without an overview about what is going on out there, about the students, the learners, they feel uncomfortable, they feel unsafe. So they would like to have something, some data, some information back to them and seeing how they really practice, how the practice is really improving and how the skills is going on. So it's easier for them to plan for the next steps to have a better strategy for education. Yeah.
Very good. Thank you.
Yeah, I concur exactly to what you say, Shella, and I definitely feel also that this is a new, not so tapped area where the students, the learners, can manage their own learning to a great extent that today, thereby also relieve their faculty from time in some ways. But I think that there is an area here where the students can develop themselves into a profession, nursing, midwifery, EMS, in a strong way, because it is about lifelong learning, isn't it?
Very good. Brilliantly said. Caitlin, as you reflect on your challenges, how have you seen SimCapture make a difference?
I think we're constantly always improving our processes, right? And a lot of this was trial and error. So it took us a long time to realize, especially from the student lens, what development do we need to do? And I want to say that we're still working on that, right? Like thinking about how to frame this to students and, how are we going to make them see that this is making an impact? I think the other, thing that has become really evident to us is, the key of transparent assessment. In an accelerated program, obviously students are, under stress, I think, the entire program just because of the nature of its pace. And one way we can try to reduce anxiety is to be really transparent in what we want and what we expect of our students. And, having transparent assessments is an evidence-based teaching strategy. So SimCapture helps us with that, right? Like, here's the checklist you're practicing with. It's the same checklist that we're going to evaluate with in your summative demonstration.
So, Shayla, maybe you could comment on that concept of a transparent assessment.
Yeah, actually, it's very interesting concept or perspective. In education, we used to think a lot about, as an instructor, educators, how we gonna teach. But within the peer-to-peer and self-directed learning, we take care about how learners gonna to learn. So using those transparent assessment, that means like what I talked about before, you can just collaborate any standard you are using with SimCapture. So the learners, they really know, they are really knowing about what they are learning and the direction they are going to, and in the future assessment, how they're gonna achieve the outcomes. So I think with all this like standard, partner with SimCapture, and then the learner just follow all those standards over there. So for example, the midwifery program, and some customer we talk before, we talk with each other before, they also mentioned something like a national-wise nursing standard. So I think it's a really good idea for the learner to really not only own their learning back, but also for them to be understanding about, okay, I'm learning about nursing, midwifery right now. But in the future, what I'm going to do and what kind of competencies I'm going to achieve. So just make them more confident and being competent about what they are being right now.
So you're explaining the why, you're explaining the standard, and then you're explaining how that meeting that standard is a building block for the next standard. Am I putting that right,
Yes.
Anna? Okay, very good. So, Caitlin, tell us, are there ethical concerns in using peer-to-peer and self-directed learning? For instance, are there concerns about faculty not being immediately present while the learners practice? Are there concerns about maintaining objectivity? Maybe you could weigh in on that, please.
You know, like you said, the recording of videos and where those are stored. So I think what is helpful with the SimCapture platform in particular is that it was vetted by our IT team. So that kind of eliminated that, right? It's a safe space. The students are choosing, or the instructors are choosing which peer specifically is providing peer evaluation to the other students. So I think that limits ethical concerns if there are some dynamics that, might interfere with providing feedback. I think the other thing, when you're thinking about ethical considerations in this type of, when using these types of learning strategies, is just the psychological safety of the student. Psychological safety is so important in learning, and especially in the simulation environment, right? Because if the students aren't feeling safe, they're not going to perform well. And we just always, strive on ensuring that we're providing psychologically safe learning environments, no matter if they're in person or virtual.
Thank you, Caitlin. Shayla, could you comment on the technical aspect of what permissions means within the context of SimCapture?
Yes, we do understand confidentiality is very, very important within simulation. So actually in SimCapture, there are multiple layers to set up a permission for the users. So which means that user within SimCapture, they are not gonna to access all the contents over there as they wish. So all the permission, or every user's permission, will be controlled by the system admin. And especially for the learners, if the educators, they don't release the content to the learners, they don't really have any chance to review the video, even though that video is for themselves. Yeah.
Very good. And Anna, what does this really mean in terms of psychological safety and the feeling for the learner?
Well, if you don't feel safe, you won't learn as much as if you do feel safe. And having a safe learning environment, that's an ethical concern for us and throughout whatever we do. But as a learner and as a student, it is very important to know where this is, where my learning and where my practice that I'm exposing, it's being taken care of in a respectful way. So it is really, really important that the students and the learners feel extremely safe and thereby give themselves into the practice so that they can gain the confidence they need for their profession.
Sure, absolutely. Very good. So, Caitlin, how does peer-to-peer and self-directed learning enhance learner engagement? How has SimCapture helped?
Yeah, I think SimCapture engages students in the learning experience as a whole because they are seeing the competency or skills demonstration from two lenses. The first is their individual lens because they are, watching back their recording and providing a self reflection so that they can see, what they did well on, but also the opportunities for growth. And then there's obviously the peer evaluation component, and the literature shows that there are so many benefits in peer evaluation because you learn from seeing others do things. So even though you're doing this skill and you might watch yourself back, but say, oh, I saw Caitlin do this and I really liked how she approached, this specific step. So I'm going to incorporate that into my practice. And, I think I mentioned in another answer that nursing is such a collaborative discipline, and engaging in the self-reflection and providing peer feedback can only build those communication and interdisciplinary collaboration skills that are just so important in our discipline.
Great points, Caitlin. Engagement and interdisciplinary learning, multiple disciplines. Anna, you're seeing that in midwifery. You're seeing multiple disciplines working together, but and comment for us on how engagement is going up there and how it's going up for the individual learner.
It's really enriching and encouraging to see when the midwifery students have been practicing a peer-to-peer scenario or a session, and they see on their phone how they're doing and how they meet the learning objectives and the ICM midwifery competencies. So just the direct feedback, as you're talking about, is really encouraging them, and they feel, first of all, feel good, and then also they know exactly then where to actually improve. So there is a direct feedback to them, which is not only from the peers, but also from the platform. When it comes to interdisciplinary team collaboration and practice at the global arena, that's really very high in the discussion among partners and among different educational fora, where really we need to focus more and more on having doctors working with midwives, working with nurses to perfection and to integrate much better in the actual practice. May it be in the education, may it be in the clinical setting, but we really need to move that motion much, much stronger, and there is a huge consensus around that. So I think this is a brilliant opportunity to actually address interprofessional disciplinary training and education as well.
And I think we've seen evidence of engagement going up across the board when those different disciplines come together. How about in your world, Shayla, are you seeing engagement going up among learners?
Yeah, of course, because while they practicing following the peer-to-peer and self-directed learning, especially when they use SimCapture, it just provides an opportunity for the learner. They practice the skills on their own to get the confidence first, and when they feel comfortable, it also allows the learners, they just go out and practice with the peer. And after all those learning journey, they can just decide, okay, I'm ready for assessment. But before I get the summative assessment from my instructor, I can also try to run a formative assessment with my peer. So my peer can provide me like more like user-friendly, or maybe just easier for them to receive those kind of feedback. So they are really happy about those learning journey, get more comfortable, and then move from practice to assessment. And it also help with their self-efficacy. Yeah.
Excellent. Thank you. Caitlin, how has SimCapture helped ensure uniformity in your peer-to-peer and self-directed learning process?
Yeah, SimCapture has helped with uniformity, obviously, because everybody has the same access to the same checklist. So there's no discrepancies in, Caitlin received this one checklist, but Bobby received another one. And like I mentioned before, because the checklists are so explicit, at least the way that we build ours, that what we're expecting of students is very transparent, which really helps when students are demonstrating that skill either formatively or summatively. The other piece that I think it helps with uniformity is with the faculty. If you don't have checklists or rubrics, it can be very subjective of what the faculty is evaluating. So with details provided on those checklists for faculty, it's very clear how they should be evaluating the student objectively, which helps with the uniformity.
And how does SimCapture enhance efficiency? Today's nursing and education environment is very much about throughput, and you've got to worry about the value of the instructor's time. So how does SimCapture make a more efficient environment for your educators?
Yeah. So I think I started off by saying that we started to use SimCapture because we had access to the portable skills trainers. And when SimCapture was rolled out, it was coupled with the purchase of a skills trainer. So one of the reasons why we moved to the skills trainers is because we realized that we needed more equipment in our low fidelity skills lab, and these seemed like the perfect solution because they were cost efficient. So when we rolled those into the skills lab, what we realized that students had more practice time because of the accessibility to the equipment, which just naturally led to, oh, let's partner and do this together. You watch me, I'll watch you, and then we'll demo to our instructor. So when SimCapture became available, we realized, this is what's happening in our face-to-face learning lab. So we could replicate this using SimCapture in the virtual environment, which clearly helps because students are having that practice time in the learning labs, but then they are also practicing more if they're realizing that they need that extra practice time outside of the lab, which is helping them prepare ultimately for, their summative skills demonstrations.
And so while your learners are performing that repetitive skills practice, that frees up time for the educator who can focus on next day's lessons, grading, and using his or her time wisely in the whole education process. So thank you, Caitlin. You had a comment, Anna?
I did. What we see from some of the institutions where we do pilot is that some faculty let the 3-year students actually practice peer-to-peer with the first-year students. And thereby, you not only enhance leadership in the 3-year students, but they also learn what they have learned together with the first-year students. And as the students working together, they also create the safe learning environment that we want to accomplish. So there's different ways of how to stimulate and motivate peer-to-peer practice between different students and
Very
learners.
good. Thank you. And Shayla, did you have anything you wanted to add?
I want to share about the technical aspect a little bit, maybe. So actually, by using SimCapture for the peer-to-peer learning and also self-directed learning, it's just like a one-time setup about a standard, about a checklist. So basically, the instructor, the teachers, they can just put the assignment for once, and then the student, they can do the standardized practice again, following their own pace to gain their knowledge, to gain their skills. So, and I also think that is what deliberate practice really means. And it also give the students not only about the chances, the times to practice, but also provide a very objective data for them to reflect on. And I think that is the key for the deliberate practice. And at the same time, the instructor, they can save their time, and they can also provide a standardized training while they are not there with the students. Yeah.
Very good. Thank you. How quickly, Shayla, do students get their scores?
Oh, the students can basically get their score like right away after the training session. So it's like just the seconds things. When they submit the evaluation, they will just like, oh, this is my personalized scores for me. And the scores also provides you some idea about which competency you achieved in what kind of level. Yeah, it's amazing. Yeah.
And the scoring process is no different. The interface is no different for midwifery. It's across the board uniform.
It's a standardized interface for everyone. Yeah.
Very good. Thank you. Caitlin, peer-to-peer and self-directed learning allows instructors to use their time more wisely. We've talked about that. Where has SimCapture helped you the most?
Yeah, I think, to be honest, I haven't talked with the clinical faculty about this in a while. And I'm, this question is probing me that I should probably ask this. But I know when peer evaluation or even self-evaluation is done correctly, the students are really getting a baseline of how competent they are in performing whatever competency or skill, whatever you want to call it. And I think when that process is occurring, they're constantly refining, their skill performance. And then when they think that they're ready to demonstrate it, they can then go to the instructor and say, watch me, and, provide me really refined feedback of how I can be competent in this skill. So I think that's really how it lessens the workload, or can lessen the workload of faculty, right? Because students are leaning on each other to provide evaluation. So it's not this, wait in line and have only the instructor give you feedback. The students can now do that. So then the instructor can spend more time, just, checking in individually as they're practicing amongst each other, but then also are giving very detailed feedback when the student is ready to demonstrate, versus like giving them a ton of feedback because they haven't practiced the skill.
Well said, and much better said than I think we could have. So very good. Thank you. Tell us what you're all seeing from our customers. So Anna, what are you seeing out there? You mentioned something from about interdisciplinary learning. You also mentioned, we all talked about the shortage of faculty and so forth. So what are you seeing from our customers in terms of efficiencies that they've gained?
I see that, as you said in the beginning, Andrew, that the midwifery programs have being put on many more students in their courses, which stresses out the faculty in different ways and the clinical preceptors. There is also a lack of clinical placements for students. And of course, there is a urgency also for the students to be prepared before they go into their clinical practice. For example, they need to practice the skills of a breech birth before they are actually practicing on a real live woman or birthing person in the clinics. So there is a lot of work that is urgent for the midwifery programs to prepare the students, but also to increase the confidence, increase the competencies as we have them set globally. So there is a global awareness of the need of more midwives, but at quality care during the education and also into the profession.
And is your observation that this approach using skills trainers and peer-to-peer learning and self-directed learning is taking some of the load burden off the educators?
Absolutely. We hear it from the pilot universities, one of them being in the US, that the faculty is very clear that this offloads them a lot of time, but also they can identify the gaps among the students in the programs at an early stage. So you can, as faculty, you can focus on what's needed to be focusing on, whereas there are other things that the students are doing very well and they will continue with.
And I think we're experiencing the same thing in nursing education. Yeah.
Yes, of course. And I think it's all about how the instructor can spend their time wiser. So by using peer-to-peer and self-directed learning, actually it gives the learning back to the students themselves, back to the learners themselves. And the instructor can pay more attention on, for example, result, scores, analysis, because education is not only about the training parts. It's not only about the practice. The learning should belong to the students, and then the instructor, they are really spend their time on helping the students, the learners, to find out where the gaps are and help them to reflect on that and gain more experience. Yeah.
Very good.
And it also encouraged them to make mistakes. You know, it encouraged them to make faults, and they can not play around because it's not a play, but they can actually experiment as much as they can freely.
Sure.
And then when they get into the clinical setting, that's the serious, and then they feel more confident.
Very good. Very good. Caitlin, how does the data gathered by SimCapture make a difference in your overall peer-to-peer and self-directed learning efforts?
Yeah, so we too are just scratching the surface with data analyses and really refining which data we want to capture surrounding certain skills. But, you know, off the bat, I think some of the advantages of the data that SimCapture can collect are it's in one place, right? Sometimes we have data all over the place and it's hard to compile the data. Two, you can track it over time. So the way we have SimCapture set up, it's cohort based. So we can track the progression of skills competency across the program. And as you know, that's key in CBE. You need to see how much students are practicing and how their practice and skill level changes throughout those practice exposures. And then one area that we haven't looked at, but we really want to, is we want to be able to, you know, look at these skills checklists and see if there's a theme of certain steps where students across the board are struggling, and then look at our didactic data, because, you know, there might be something said for analyzing themes and then saying, oh, I thought we were teaching this really well, but we really aren't. And that's why our students aren't performing well on, you know, steps 3 through 5 on sterile field setup.
Excellent, Caitlin. Thank you. Sheila, can you share what instructors will see? What is Caitlin actually seeing when she looks at data?
Yes, and actually when the instructor, after the student, they practice all those skills and the evaluation is submitted to the system, the instructor, they can just easily log into the system again and track all those data. And within SimCapture, we provide different sort of reports to the instructor. So the instructor, they can easily tracking individual performance, but also the cohort's performance. And At the same time, they can also track not only about the results of the learner's performance, they can also track like the analysis of the evaluation tool itself. So it really provides data reports from different perspectives to let the instructor to gain more insights about from the learner itself and from the evaluation tool itself and from the evaluation design itself. So it gives the overview to the instructor how they can develop the assessment in a better way. Yeah.
Very good. Caitlin, now the big question. What's your favorite peer-to-peer learning or self-directed learning success story?
Yeah, this is actually a challenging question for me, Andrew, because I'm not like the face of the course, right? Like I am behind the scenes thinking of these activities and working with faculty to implement them. So, I think one of the sad parts of my job actually is that I get to collaborate with faculty and come up with these, amazing ideas, but they're the people with the boots on the ground all the time. And, they're the ones that are working out the kinks, but also seeing these successes. So I have to say, like, because I'm behind the scenes, what is I think of as success is one, the faculty did it, right? Like we pulled this off. It went, we might have a couple bumps that we need to iron out, but there were no big hiccups and they weren't upset. And I think, it's always really successful for me when I can see the alignment, right? Like you just taught about we'll say, inserting a urinary catheter, and you're talking about, regulation and eyes and intake and outputs. And then they go to lab and they see how all these things come together, and then they're practicing it at home. So I really love to see that we're able to create the alignment for the students, and hopefully the students are, seeing how it all connects the dots too.
Caitlin, we loved that. Thank you very much. Now we're going to turn to some frequently asked questions. First one, how does a user create content that goes into the checklists?
Yes, user can create the contents yourself, and of course we provide a relevant service to help you to create the contents. It's basically log into the system and go into a course and put your evaluation into that course. It's quite straightforward. Navigate the browser, and if you want to make your life easier, and we'll provide service for you to help you create the content.
And Anna, you wanted to comment on ICM
Yes.
competencies?
So together with the International Confederation of Midwives, Lärdal have co-created some content, 50 practice sessions based on the global ICM competencies for midwifery education programs. And that is super exciting. It's the first time we do this. So, but we see a really strong interest and a strong need for these practice sessions already developed on SimCapture. So that's a new feature of ours.
Very good. Here's another. I can't even figure out how to use my TV remote. How difficult will SimCapture be for me to use? Can I use it myself, or will I need to hire an expert?
Of course not. You don't need an expert on that, because first of all, SimCapture is not that difficult to use. Basically, you just need to turn on your PC, connect it to the network, and then run the browser, log into it, and basically that's all. But of course, it will depends on people have different learning curves, right? But if you feel really struggle about that, we provide educational service to you to show you how to navigate through the whole system, and also will help you to relate the system features to your daily practice to make you really can get the system up and running. And also, along with all those services, we provide free e-courses for users. So user can just log into your Lärdal learning platform to find out all those relevant e-courses to navigate you how to use the system, from maybe starting a recording to how to find out the reports you need to do the analysis. Yeah.
Very good. And how will my role as an educator be different using SimCapture for peer-to-peer learning and self-directed learning?
SimCapture provides instructor a chance to spend your time wiser, as we talked about before. And an instructor using SimCapture for peer-to-peer, you are not only about an instructor. You focus more time not only on instruction, instructing the student, you can just do it maybe once or twice, and after that, all you need is spending your time on analyze the results, the scores, to find out the gaps over there and help the learners to achieve their learning outcome easier.
So with that, I think we're going to bring it to a wrap. So we've talked about today peer-to-peer learning and self-directed learning and some of the basic principles of that. And thank you both for sharing some of your wisdom. And Caitlin online, thank you very much for sharing your wisdom and your insights and your experience on peer-to-peer learning and self-directed learning. We talked about skills trainers and the development of skills trainers. And we talked about SimCapture and how SimCapture can tie it all together and create a more sane, a more controlled, efficient process, driving quality and certainly driving competency-based outcomes. And it all started with one of the original skills trainers in Orange. Caitlin, thank you very much. Caitlin Picard from the University of Rochester School of Nursing in Rochester, New York.
Yeah, you're very welcome, Andrew, and thank you for inviting me. It was an absolute pleasure, conversing on this topic, and I wish all the listeners success with their implementation process.
I'd like to remind everybody that Laerdal's mission is helping save lives, and what we do with SimCapture is a part of that. We have a full webinar series, and we invite you to check out and view all our webinars. Certainly, you can learn more about SimCapture by talking to your Laerdal representative, and you can find out more on laerdal.com. So with that, I'd like to wish everybody a great day. Have a great day wherever you are. Well done.
Thank you.
Thank you.
Andrew.